And so this is how we approach venous thrombus. The patients are typically in a prone position. I use ultrasound guidance 100% of the time for access. In a lot of these cases, you have popliteal vein thrombosis. And so you're going to have to access an occluded vein. And it can be different if you have soft thrombus or a chronic thrombus. So typically I'll use a micropuncture needle, a 22 gauge, get access, ensure that you're in the lumen. I give a little contrast puff because sometimes you can be outside of the vein. And then I advance my wire. In cases of chronic thrombosis, you might need to use an 18 gauge needle and an 035 wire just to get through. So after you get access, the next point is crossing and finding out where the vein is actually recanalized and open and thrombus free. For us, we use 035 crossing catheters. In this case, I used a glide wire to cross the lesion, which was relatively easy. The first step in treating venous thrombosis and extracting this is to insert the sheath. This is a 12 French sheath that you can see the funnel that you can expose after insertion. It inserts very easily over an 035 wire. Next, we cross with an 18 thousandths wire. And typically what I used in this case is a glide wire advantage, but you can use any supportive 18 thousandths wire of your choice, Gladius wires, V18s, and so forth. But cross beyond the thrombotic area. And the next steps are essentially relatively simple. You unsheath, and you can hopefully have a model here to practice on your own and see how it works. But you can unsheath the distal basket, and then after you unsheath it, you turn the knob, and you're able to expand the basket, which again goes from 6 to 16 millimeters in diameter. And so from there, you do the mechanisms of action for venous thrombectomy, which is collect, macerate, and extract. I do very slow passes to be able to perform adequate thrombectomy. You can see here just the rate of speed at which I'm withdrawing the catheter, and we'll keep moving there. So you can see when you get to the femoral vein, however, there's areas of chronicity, and you can feel it when you're doing the retraction of the catheter itself. So when you do this, the wire lumen, there's an area where you can push and to retract the basket so that you can then freely pull it through stenotic areas. So on the right, you can tell that it's more chronic. On the left, you can tell it is more acute. There's a wide spectrum of morphologies within a case of a venous thrombus event. And so my final take-home points, this device is low profile, okay? So I think that provides a lot of benefit, especially if you think about upper extremity venous systems. You can easily insert the sheath and do the thrombectomy that you so desire. And I've noticed with my own experience that what I'm looking for with a thrombectomy tool is a tool that can treat the full spectrum of the disease. And I found the Pounce as being that tool, treating from the acute phase to the chronic phase. So that is one of the key points that I wanted to mention. It's easy to use, and the multiple mechanisms of action are clearly a benefit.